Hello everyone and welcome, dear colleagues and dear doctors. Welcome to our presentation and research. Our research is on health communities in health communication in online communities from the perspective of sustainable development. These are our names, the group names, and our metric numbers as well. And this is the content of our research: the abstract, the background of the study, the literature review, the research problem, research objectives, and the methodology that we are going to follow. As you can see in the first part as the abstract, the COVID-19 poses a particular challenge on healthcare system. As we have witnessed the last 2 years since the beginning of the COVID-19, the number of cases were to rapidly increase per hour. That did pose a very high risk and challenge on the healthcare system. The rising of mobile internet and online health communities has helped to meet the health needs of the general public. Many health organizations are using social media to promote social health campaigns awareness, just as we've seen during the COVID-19. WHO, the World Health Organization, did implement a lot of social media platforms to help spread the awareness of the danger of COVID-19, how to stay safe and aware of what's going to happen, and how to keep ourselves protected. The growth of social networks and online health communities has permitted many aspects of economic development, national security, and people's lives. Universal health coverage will be integral to achieving SDG 3, which is the health sustainability. Online communities play an important role to achieving good health and well-being. This is the background of our study, as we had to go and check what is health. Why is health important? Health is the core and driving force of sustainable development. The United Nations regards health as one of the main contents of the past 2015, the Sustainable Development Goals. It is the great and far-reaching significance for the strengthening global health governance and providing healthy support for the economic and social development and social security, stability in various countries. The World Commission on Environment and Development, WCED, defined sustainable development in 1987 as a development which meets the needs of the present time without compromising the ability of future generations to meet their own needs as well. So both of this time present and the next generation can benefit from the earth resources and this sustainable development that we have as far. Therefore, in order to ensure the sustainable development of society, in particular important for the public to realize the importance of health society is through the use of communication campaigns to inform and educate the public about healthy habits, and good health care. Although this has been done many times, they tried to raise awareness. Still, creating an effective communication campaign can be a complex process, so they can be especially challenging to develop an effective communication campaign to check. Moving to the literature review, divided into health, sustainable development, and how was it defined, and then health communication, the multidisciplinary research perspective, the health communication strength and strategies for sustainable development, and the conclusion out of it. Going back to what does health mean? Where did we get this word from? Health is an original Old English word that means health, and health means whole, to imply that health is essentially holistic and concerns the whole person: integrity, soundness, well-being. If you're healthy, you're fine. Health is inherently a social phenomenon. And finally, health and disease, not a state of object waiting to be uncovered and investigated. It is rather the active produced by and negotiated by ordinary people. Sustainable development was defined, as we've just mentioned, the development that meets the needs of the present without compromising the ability and the future of the next generations to meet their own needs as well. Sustainable center on the needs of the future generation, while development centers on the need of the present generation. Moving to health communication, as we said, that health and human health has to be recognized as one of the foundations of sustainable development. Number two, that health is a basic human right that must be fulfilled. World leaders did commit to the 17th Sustainable Development in 2015. Number three, the SDG 3, was to focus on health, including that health does actually contribute to an economic growth and security. Finally, poverty prevents people from receiving enough health care. Poor countries do suffer from less health care provided to its people. As we said here, the sustainable development does include healthcare, social networks, digital access, and access to justice. In the light of this pandemic experience, as we have seen, that we do have health communication and sustainable development in two sections. The multidisciplinary research perspective in health communication strategies for sustainable development, as you can see. In the multidisciplinary is to be effective and sustainable. In health communication needs to be studied by the use of the integration of multidisciplinary perspective that to try to grasp the complexity of health issues in both the global and local in communities level. In health communication strategies for sustainable development, it is in order to master the complexity of health communication strategies, one needs to be interdisciplinary trained. Culture competency are needed for health communicators, healthcare providers, and public health personnel as well. Finally, as we concluded by issuing a call for more research attention on tackling the SDGs. As you can see here, to sum up, we have 2 points for the literature review. In terms of health, sustainable development topic, including the importance of health to sustainable development, factors affecting sustainable health development, and conditions for sustainable health development have been increasingly popular in these few years. People are focused on more, and more work has been produced. With regard on health, more scholars, or many scholars actually, are suggesting research from an interdisciplinary research perspective, proposing particular strategies to develop the capacity of multiple subjects in health communication and initiative to use digital technology. Moving on to the gap that has been found in the literature review. Most of previous studies did lack the unified research paradigms. The development of mobile internet and online communities has blurred and brought closer the research horizons of natural and social science. A new cross-cutting of marginal disciplined computational communication has emerged. This unifying research paradigm introduces research method from computer science into sociological research, and provides a good reference for health communication research in new media context. These are the questions, these are the research problems that we will try to answer. How to look at health and disparities in the world system from the perspective of sustainability. How are online and offline health behaviors shifting? What is the dimension, the dissemination path of health information in online communities? What are the interaction patterns within online health communities, and what are the underlying motivations for participation in online health communities? These are the research objectives, just in brief. to explore a sustainable comprehensive research paradigm, exploring the importance research issue in the field of sustainable development, to strive for innovation in academic theory, research method, and research system as well, by conducting systematic and three-dimensional research on sustainable health communication within online communities, and enrich the traditional theoretical framework of health communication. Now, finally, we got to the methodology. How are we going to do that? Simple here is we needed two methods in order to answer these questions. We needed the quantitative and the qualitative methods as well. For the quantitative method, we had to go and collect data from the spring rain data. The number of the users per month. Are they increasing, decreasing? When did they use it the most? The gender of and the age of these users. Are they males or females? Are they teenagers? Are they in the limit of their 30s? Who exactly tend to use these applications, especially the spring rain doctor? The type of disorders or diagnosis that has been researched. So do people tend to go and search the psychological disorders more than they do the physical disorders? Which diseases is most researched by technical name? So, for example, how many people did search the word COVID-19 symptoms instead of searching the symptoms and looking for the disease itself? Finally, the income. Does it affect? Do people with no income tend to use these applications because they cannot afford a visit to a doctor or not? The second part of the methodology is the qualitative, as we mentioned. Interviews will be conducted on a focus group out of 300 members of community health users to take into further reasons and explanations for the use of online health community. We might have just forgot some reasons, and into our considerations, we do have to ask people for their own reasons and explanations. This research group was divided into 3 groups equally. The first one is less than 18 years old. The second one is 18 to 30 years old. And the final third group is 30 and above. Now, the online interviews, and this is the most important obstacle that we do have to overcome, is that it's not easy to ask people about their own psychological or physical, let's say, concerns. So how do we have to overcome this? That the interview will be conducted and answered anonymously. No one is going to write their names. They don't have to care about who's going to know. And that is, puts away the people's shyness and allows to share their physical and psychological concern, and makes it easier for them to just share it and answer honestly. That was the end of our presentation. Thank you very much for your time and listening, and hope that it was fruitful and you've enjoyed it. Thank you very much.